$47 per person in 1960. Consider this. If healthcare costs rose with a normal rate of inflation, that $147 would now be about $1,200. Instead, it's nearly 8 times that. Why? Well, Blue Cross Blue Shield and the Peterson Kaiser Center on Healthcare highlight a few of the reasons. But the biggest cost is the treatment of chronic diseases, which account for 86% of total health spending. Some of those chronic diseases are directly related to things like America's obesity crisis, diabetes, and arthritis. Another reason that we spend so much on health care is the huge jump in prescription drugs issued to Americans. Much of that related to what we just talked about. A final stat for you. In 1960, America spent just under $3 billion on prescriptions. 55 years later, that has grown to more than $45 billion, a change of more than 1,500%. And get this, last year, more than 4 billion prescriptions were filled at American pharmacies. Now, on Squawk Box this morning, Toby Cosgrove, CEO of the Cleveland Clinic, talked about the alarming issue of cost.
I don't think they're dealing with the root cause of the problem. The root cause of the problem is not how you divide the money. The problem really is the rising cost of health care.
Yeah, let's now bring in Stephen Brill, NBC News analyst and author of the New York Times bestseller, America's Bitter Pill. Stephen, I mean, we're bringing it up. Dr. Cosgrove is bringing it up. Basically, we're trying, Congress has an impossible job because they're trying to figure out a way to pay for a system which is probably something you can't pay for. $3 trillion and continuing to grow. Have you been able to identify in your research why we spend so much money on health care compared to everybody else?
Sure. Congress doesn't have an impossible job. They're just doing the wrong job, as Toby Cosgrove pointed out. They're focusing on the cost of health insurance premiums. And health insurance premiums cost so much because the health insurers, just like you and me, have to pay for the high cost of drugs and the high cost of hospital stays. And why is that cost so high? Because in the United States, we tried an experiment that no other country in the world tried. We decided that we're going to make healthcare a free market product. So drug companies, once they have a patent, can charge anything they want. Hospitals can charge anything they want, and they can merge and buy up doctors' practices so that the insurance company, if they have to negotiate with the Yale New Haven Hospital in New Haven, it's the only hospital in town, so they have to pay whatever the hospital asks them to pay. So the issue isn't what Congress is doing about insurance coverage. The issue is, why are we the only country in the free world, for example, that doesn't do something to control the cost of drugs?
Because it promotes a tremendous amount of innovation and new drugs, etc. No, a lot of people would argue that we need now a free market in health insurance where none of us here actually buy it out on the open market, right? We get it through our employer. There's a very, very small individual market. I thought you had stopped talking.
No, I didn't have a chance to finish my point. The drug companies spend less on R&D than they spend either on stock buybacks or on marketing. That is a total myth. And the drug companies are very happy to sell in Europe and in Asia for half or two-thirds the price what they sell for here. So even assuming you were right, what you'd be saying is that the United States has signed up to pay a premium for drugs so that they can be less expensive all over the world, which isn't true anyway.
No, we have argued long on this show, sir, if you could hold on for 1 second, we have long argued that, in fact, it should be the government getting involved with the World Trade Organization and saying to places like Japan and like Germany, why do you, a rich country, deserve cheap, price-controlled drugs?
They don't
Why
have
are we
cheap,
subsidizing?
They don't have cheap price-controlled drugs.
You just mentioned that
I said they're less.
U.S. companies sell for far cheaper overseas. You don't think they're bullied into that?
I didn't use the word cheap. They sell at less exorbitant prices. The drug companies in the world, the drug companies in this country have profit margins, gross profit margins and net profit margins, after all that great R&D you're talking about, that are higher than Google, that are higher than any industry you can name. Why is that? Because we give them a monopoly when we give them a patent, and they can charge anything they want. It's not that the cost of drugs is cheap in Germany, it's just that it's at a slightly higher than normal profit margin, whereas in this country, it's a double or triple that profit margin.
Are they able to
Are those countries able to sell those drugs or buy those drugs at lower prices because they have national
Of course they do.
national health insurance programs that negotiate that price, and we
Of course they do.
fundamentally don't.
That's exactly right. Congress doesn't even let Medicare, the largest consumer and buyer of drugs in the world, doesn't even let Medicare negotiate the price of drugs.
So you've mentioned, and I think interestingly, the idea that drug companies are given patents on their discoveries, but shouldn't they? I mean, shouldn't they have some period where they benefit from the intellectual
Of course
property
they should.
ownership? And so, how would you change that? Is my
Of course
question.
they should. I would do what every other country does. Is that they have patents that apply there too, but they apply some control to the prices so that the CEO of a drug company can't wake up one morning and say, the $200 we're charging for this pill, let's make it $1,000. What the heck? That is abuse of a monopoly. Every other country does it. This is not rocket science. The same thing with nonprofit hospitals. The same thing with medical devices. We are the only country in the world that does this. Our healthcare results are no better and often worse than every other country, and our costs are 50 to 80% higher than every other country. Why is this such a mystery?
Profits are what brings products to market. And we
But
would
they
actually
would
have
have-
far better
they-
products on the market if other countries actually did it our way.
So you're saying that if one of the drug companies only had a 30% margin instead of a 60% margin, I'm talking net, not gross, that they would just decide, let's go out of business, it's not worth it?
No,
Okay, thanks.
you're making a totally different point than what I'm making. Profit is what brings things to market.
No
The
one is
more
against
you control
profit.
the fewer products you will get. And if you start to squeeze margins, you'll get less of it. It's that simple. That's the trade-off that we have accepted in this country. And you're right, I think it's completely wrong that other countries try to control profit margins so much more than we do. It's not fair. They're wrong, not us.
Stephen, I'm gonna let's change the topic just very quickly before we let you go. I get no response to Michelle's question, which is at what
Well,
point
she's very sure of herself, so I'll just leave it
So
at
are
that.
you. I'm just matching you.
What?
You think a single-payer system is the best way to go. That's
Did
your
I
position,
say
right?
anything about a single payer system?
No, but you want a lot more government control. It gets a lot closer to single-payer.
Did I say anything about single payer, or was that some interview I wasn't involved in?
No, I guess you're just using different words to describe what most other countries do.
No, actually, a lot
You know,
of other
Stephen,
countries
we're-
don't have single payer, but they have some controls on profits of a product where the consumer has no choice but to buy that product. That is not a terribly exotic argument, and it's not a terribly left-wing argument.
Stephen Brill, we are going to leave it there. Listen, it was a meaty discussion, a heady issue. It's not going away. This issue of cost, at least now people are talking about cost instead of just how to pay, how to pay, how to pay. Somebody's finally asking, why does it cost so much? Stephen Brill, thank you very much.
Sure enough.
Warren Buffett calls the Republican health care bill, quote, Relief for the Rich Act. Wealth editor Robert Frank joins us now.
Well, the Senate health care bill would reduce tax revenue by $700 billion in total, yet 45% of those gains go to the top 1%. The legislation would repeal the tax hikes imposed by the Affordable Care Act. That includes the 3.8% net investment income tax that's paid on dividends, interest, and capital gains, as well as the 0.9% Medicare payroll tax surcharge. Both of those are aimed at people with incomes of $200,000 or more. So, of course, the top benefits. Now, overall, the Senate bill would cut annual household taxes by a total average of $670 a year. Middle-class earners who make between $55 and $93, they would see a tax cut of about $280 a year. That's about 0.4% of their income. The top 1%, they get an average tax cut of $45,000, and even on a percentage basis, much higher, 2% of their income. Now, the richest earners are the top 0.1%. Those who make $5 million or more a year, they get an average tax cut of $250,000. That's a cut of 2.5% of their income. Now, as I mentioned, any tax cut of any kind these days would benefit the wealthy since they pay most of the taxes. And of course, lots of people say this isn't a tax cut, it's just reversing those hikes that were part of the Affordable Care Act. Billionaires, though, could see much bigger gains. Warren Buffett saying that some of his friends would be saving $10 million or more if the bill passes.
And this is all because of the surcharge on capital gains, mostly?
You are taxing things that mainly the wealthy take, which is dividends.
It's called like the net investment
net
tax
investment.
is what you said. So it's only been around a couple of years.
Yeah, and look, I'm not saying people should be for or against it based on this, but this is something that the healthcare bill writers are going to have to address rhetorically at some point, because this is going to be the charge from the Democrats going down.
And I think the sad part is, and I'm not saying that's not important, but I think the sad part is kind of goes to every conversation we have about healthcare now. I mean, Chuck Schumer the other day, 10 seconds into his comments, responding to Mitch McConnell, he talked about tax cuts for billionaires. No one's talking about why we're so sick, why healthcare costs so much. All we're talking about is taxing. It's clouding the entire serious issue.
It's an important economic component, and there are people, our viewers, who might be in that group. Exactly. Thank you, guys.
Thanks, Robert.
Thank you. Here's what's coming up in Power Lunch. Oil still below $45 a barrel. At what point does this become a big problem for the drillers? Blue Apron is going public, but it faces a whole lot of competition. We'll talk to the head of another meal delivery company. And is turmoil in D.C. affecting how CEOs view the economy? All that and much more coming up on Power Lunch.